Hi, I'm Dr. Molly with Your Goals Physical Therapy. Did you recently throw your back out doing something silly like picking your kid's backpack up or any of the other numerous bags, however many sports bags they have, their lunch box, their just all these bags. Kids have so many bags. Anyway, I received a phone call from a young lady who went to go pick up her kid's bag. She wasn't even going to carry it because, of course, her child was going to carry it. She was just trying to be nice and help everything along. So she bent over, picked up the bag, and all of a sudden she felt the most searing pain in her lower back. It grabbed her so bad that she dropped the bag, which then the kid got upset about, and I don't drop my stuff. But she couldn't move for a good 3 or 4 minutes because the pain was so intense in her back. She thought the spasm was just going to rip something apart. And so she managed to get her composure enough to drop her kids off, and then she came home. She had to call and tell work she was going to be late, but she came home and she tried to do some ice, and she tried to take some over-the-counter medication, and it really didn't work. And so she got onto the computer because now she's just freaking out because all she did was pick up her bag. How bad could she have hurt herself? But this pain was something that she was not familiar with. She didn't want to go to her primary care because she didn't just want hydrocodone or whatever medication they were going to give, and she didn't want to go to the ER because she didn't want to talk to a doctor about surgery. She just wanted to know if there was some other option before she went down that route. Not to mention, she told me she was terrified of what it would cost if she did go to the ER to find out what was wrong with her back. So she found some of my blogs online, and so she decided she would give me a call. And thankfully, we were able to get her in pretty quick just to at least calm things down and do an evaluation and assessment to see what was happening. And thank goodness. So it was a relatively simple thing. And I'm going to explain a little bit, right? What she was suffering from was a very severe muscle spasm. And that can feel like your whole back just got hit by something very, very strong. It just grabs you. In some people, depending on where that muscle spasm is, it can literally send shock waves down your leg. It can really feel like everything in your spine just basically exploded. And so it's very scary. For a lot of people, they do end up at the ER. I talk to lots and lots of people that are clients, friends, family that wake up one day with such severe pain from something minor. I mean, picking up your kid's bag should not cause this kind of agony, and it's just very scary. So you end up in the hospital, and thankfully this person did not, and with some hands-on care she was up and walking around relatively straight right after the first session, and she was able to get some things that she could do at home immediately to help resolve that. The other nice thing is that she walked away because I was able to explain exactly the mechanism of what happened for her. And generally, a lot of people think that back pain stems from either a weak back or something in that sense, right? But truly what happens is we use our lower back muscles for everything. We use our lower back muscles when we sit, when we stand, when we pick things up, and they're not truly designed for that. Our little back muscles in the small of our back, so in our lower back, they're designed just to help stabilize our bones in that nice little curve. So again, if we go back and we look at kids and basically their spine is pretty straight, right? There's a little curve, but it's not like a dramatic S curve or anything. It's just a little curve. And these back muscles are designed to keep our vertebrae in line in that nice little curve. But because the way we sit, we end up reversing that curve, which effectively stretches those little muscles all day. And we don't think about this, but if a muscle's being stretched to their max length, they end up doing something protective where they're actually pulling on those bones all day, at a low grade pull, like just constantly under tension, trying to make sure that the bones don't just separate. So we go from that very, very overly stretched position to then we stand and then we maximally contract them, because most of us stand with an extra, with that curve is just extra like C-shaped, right? It's really, really deep. It's a very pronounced curve. And so again, they go from a super stretched position, like overstretched, and then we come and we really clamp them and we use them for everything. If I'm gonna bend over and I'm gonna pick up my groceries, I'm not using my hip muscles to hinge from. I use my low back because it takes less energy. I'm just gonna bend over and pick that thing up and stand back up. But most people do not hinge at their hip. They don't bend forward again, at their hip. They don't use their butt muscles to help pick them back up. They use those lower back muscles to help lift their whole torso back up. Over time, that causes those muscles to get weak and just overused until it really is something as simple as just bending over to pick up a pen, a light backpack, just a piece of paper, something very, very minor. And you're like, well, this weekend I picked up a couch and it was fine. and that happens more often than you would think. You're like, I just picked this pin up, but literally last weekend I helped my friend move. And ultimately what it ends up being is that they did so much work a couple days before that your muscles were still tired, and this was just the last straw. And the scary thing is, for most people, is that this kind of reoccurrence happens over and over again, because if it goes away in a couple days, people don't go see somebody about helping them figure out why it happened and correcting the why, because it went away, so it's just gone. And I mean, I would do the same thing. If I hurt myself, I walk it off, and in a couple days it's gone, then great. The sad thing, though, is that happens when you're in your 30s, then it happens again in your 40s, sometimes more than once in your 40s, and then in your 50s, now you're like, well, this is old hat. I just always have this problem. Instead of finding somebody to help you fix it. And sometimes when you even go to get help from a medical practitioner, they're not even educating people that there is some form of therapy that can be done to help get it to where you're not just using your back muscles. And that is what I help people do. So with my mom that I was talking about earlier, when she came in, we definitely did hands-on, because she needed that muscle spasm to be eliminated. That needed to calm down so that her pain level would subside. And then in the subsequent sessions, we'll be going over how to use your abs and how to use your hips and how to stretch things out so that you're not overloading those lower back muscles all the time. And if you learn how to move in a different way, these injuries do not reoccur because you're not overloading those same tissues. So if you have been dealing with reoccurring back pain, that happens again with something small. I mean, these don't have to be catastrophic. Like, you don't have to be moving a boulder and get back problems and have that be the only reason why you see therapy. A lot of times it's the little things that just accumulate over time. So if you've been dealing with these things for a long time and you want to finally find the root cause of what's happening for you and your specific situation, this is what I help people with. And it is awesome to help people with back pain, because ultimately that typically stops people from getting back to running. Your back pain will stop you from wanting to squat or work out or take long walks or go on hikes. So addressing your back pain can ultimately open up so many other things that you might have been hesitant to do in the past. And you can get back to doing those with absolutely no pain and no fear of re-injuring your back, especially once you're done with these specialized programs, because you'll learn how to move and feel better in your own body. So if you're looking for this type of care, I'm going to give you a couple options. So I know a lot of people don't like getting on the phone. It's just a lot of work. So if you prefer email, I'm going to leave my email in the notes below. And some people are just trying to get a little bit more information. And so why don't we do a free discovery visit? This will be a 30-minute session that we spend finding out if I'm the right fit for you. You'll get to ask me questions about what's going on specifically for you. I'll be able to tell you whether or not that's something that I can help with. We might get into a short movement assessment just to confirm that I'm the right person to help you get back to your goals. So if that's what you're interested in, you'll just click Discovery Visit in the show notes below. And I hope that you're having a great day, and I hope to speak to you soon. Bye.